We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
According to the U.S. Department of Health and Human Services, the goal of Operation Warp Speed is to produce and deliver 300 million doses of safe and effective vaccines. In the U.S., vaccinations began on December 14, and 6 weeks later, according to the data collected by Bloomberg, an average of 982,739 doses per day were administered. That's almost 1 million shots a day. But will there be enough vaccines for everyone? Can we halt the spread of coronavirus? Is there an end to this pandemic? Joining us in today's program are two sisters who are at the front line of providing healthcare services to New Yorkers, spreading the dread of living with a lethal virus. Dr. Alicia Almendral is an American board-certified family physician and geriatrician for 23 years. She runs a private practice with clinics in Manhattan, the Bronx, and Queens. Her sister, Bernadette Sta Maria, is a certified registered nurse anesthetist. She has been a staff nurse for 10 years in New York before becoming a CRNA for the past 16 years in New York and New Jersey. It is not uncommon to see more than one healthcare provider in a typical Filipino family like the Santa Marias. Actually, Doc Alice is telling us that 2 of her kids would like to be doctors too. On behalf of my co-hosts Rachelle Ocampo and Cristina Pastor, I'm Jen Fira, and we welcome you to Makilala TV. So ladies, COVID-19 is the biggest vaccine campaign in history. So how do you think we're doing so far? Let me start with Doc Alice.
Hello, Jen. Hi. Thank you, Makilala, for inviting me over. A little bit about the vaccines, COVID-19 vaccines. And so to answer your questions, it's going a process of trying to vaccinate everyone, although we have limited supply of the vaccines right now, but we are continuing to encourage everybody to get vaccinated against COVID-19.
Yes, go ahead.
So, Doc Alice, I have a question for you and for Bernadette, if she can jump in at any time. So the goal of the Biden government is 100 million vaccines, 100 million arms in 100 days. Is that doable?
I don't think so. There's an ongoing problem with the supply. But of course, that's the goal. That's the goal. Actually,
yeah.
To answer your question earlier about if all healthcare workers are already vaccinated, well, I would say some are still kind of skeptical about getting these vaccines. They're just waiting for everyone else to finish the second dose and see the reactions. But since I work in an urgent care, I would say 90% were already vaccinated.
90% of healthcare workers, you mean?
In the urgent care where I work at. So yeah, which is good.
It's similar to my health center too. We have over 85% of our staff who have been vaccinated, at least the first dose. A lot of our staff are getting our second dose in the next few weeks as well.
So Rachelle, Rachelle, you already got vaccinated. Did you get your second dose already?
I will get it next Friday. Yes.
And did you have any side effect on the first dose?
No, just some swelling on the injection site. But it disappeared maybe after 2 or 3 days. But it was similar to the effect of the Tdap, a shot that I got when I was pregnant. So it wasn't a bad reaction. It was a natural reaction.
Okay, I'm gonna get back to you because you're pregnant, you were breastfeeding, but I want to, if we can get Bernadette and Doc Alice, I'm sure you already had your second dose of the vaccinations. If you're, can tell us if you have any side effects for those who are like wary to get the vaccines.
I had my second shot January 8th, and all I had was swelling and a little bit pain overnight, but that was it. No other side effect. Although some of my coworkers have complained, they've had like fever, body malaise, and I
Mm-hmm. Yeah.
I think that's the general consensus, is that people have a range of reactions, but not something so severe that should dissuade you from getting the vaccine. Because if you think about what's the purpose of the vaccine, it's to protect you from COVID, which we know for sure what the effects are. So for me personally, the benefits outweigh the risks.
So what about people? What about people with allergies? What kind of allergies are prevented from having the vaccine?
Right. So the only contraindication for this vaccine, if you have an allergy to polyethylene glycol or Miralax, okay, so that's a contraindication. Well, with regards to if you had extreme or severe allergic reaction to previous vaccines, then maybe, it's not that we're gonna not encourage you to get the vaccine, but we will observe you for at least half an hour. Okay. So as far as I know, those with allergies to polyethylene glycol would,
So seasonal allergies should not disqualify you.
no.
Okay.
Well, I heard some people who talk about some of the young men or young adult men don't want to get the vaccine because they're scared they might not be able to reproduce. Is there any truth in that?
Well, if you consider the action of these vaccines, it doesn't really enter the nucleus. It doesn't affect the DNA. So no, it will not affect the fertility or sterility of a person.
And there is, I have to go check the resources for this, but I've heard that there were actually about 25 women who were in the Pfizer study that became pregnant after getting vaccinated. So in those clinical trials of the hundreds of thousands of people, of the thousands of people that got it, there were people who were able to get pregnant and have uneventful pregnancies, so no complications.
I guess my next question is, when you get your first shot of vaccine, does that mean you're totally free to do anything now? So what's the timeline? Do you wait for the second dose, and when do you get the second dose?
So for Moderna, okay, so there's two that's approved or in emergency use in United States. That's the Pfizer and Moderna. So I received the Moderna vaccines. I got it on December 31st, and studies have shown that after the first dose, you have to wait for about 2 weeks, 1 to 2 weeks, and it's about 50 to 52% effective. So that having said that, you can still get the infection even before just immediately after the vaccine because it takes time. It takes time for your body to develop the immunity. And then after the second dose for Moderna, it's 28 days. After the second dose, you have to wait maybe about 1 to 2 weeks. Then it becomes about 95% effective. For Pfizer, it's actually 21 days apart for the first and the second doses. The second dose.
So
what I'm reading actually is that there are vaccines. The problem is the logistical distribution of them. Is that correct, Doc Alice?
Right. So in the urgent care where I work at, so we received 200 doses. Okay, so those 200 doses are just for 100 people. So it's already reserved. So we can go more than we cannot vaccinate more than 100. So but to be honest, I have a private practice, right? So I ordered 200 doses on December 5th, and I still don't have anything right now. So I'm still
It
waiting.
hasn't been delivered to you?
Yeah. So I'm still waiting. I haven't received anything yet. So I heard that they might be, or we might be receiving it sometime in April, but I just don't know when.
So what about the people who signed up in your office, in your clinic? How long do they have to wait?
I cannot tell. I just tell them that I'm just gonna announce when I get it.
Oh,
But
okay.
there are websites actually that people who belong to phase 1A and 1B, where they can try to make an appointment, but it's really, really hard.
Yeah,
Mm-hmm.
there's, I think you have to go to your state's website to pre-register. And then once you know what phase you're on, whether phase 1A, 1B, 1C, or 2,
Mm-hmm.
and then you can go into your county's Department of Health website to find available spots. It takes a lot of time, and I feel bad for the elderly because sometimes you have to figure out how to work the internet and clicking in on all those different links. So
Do they have
if
do
you
they
have
have to wait for a long time?
family members who are older, try to reach out to them and help them get a schedule. Well, Bernadette, you work in a hospital.
Yes.
Does your hospital administer vaccines?
Only to workers, to the employees. We don't administer vaccines to patients. So, like I said, I mentioned earlier, almost close to 100% vaccination was already given to the employees, including maintenance, everybody. Although there are some of us who are a little skeptical,
Mm-hmm.
and the ones who had infected have to wait 3 months before they get their first shot.
Mm-hmm.
So only those were not vaccinated yet. But as soon as we get the vaccine, everybody signed up for it, and it was so well organized. There's nobody left behind unless you choose not to do it.
I think that's great. I mean, those who already had COVID vaccine, I mean, those who already had COVID, why do they still need to get vaccinated?
They still need protection because this is a new vaccine, so this is a new disease, so we're not sure what kind of immunity we get from it and how long. I'm sure you've heard and you've seen a lot of reinfection. So we still need this protection.
Mm-hmm. So
There are
Will
to
really
answer
the
that,
vaccine will the vaccine protect us from the new variant coronavirus? The one that came from the UK ostensibly?
so that is still under, you know,
Oh,
investigation or study, but because it has spike protein, so they say it might be effective, but we'll
Mm-hmm.
see. We don't know yet. But to answer your question earlier about, if a patient had COVID-19 infection, can they get vaccinated? Yes, but when you have the natural immunity, you get natural immunity from getting the infection itself. There's seemingly like a 3 month, a 2 to 3 months of natural immunity without that you can still get infected. So that's based on the studies. So you can get vaccinated still with COVID-19 vaccine, even if you had the infection. I would say once you recover and you're off the quarantine, because you don't want to infect the injector. So maybe as early as 2 weeks, 3 weeks after your infection, you can go and get the vaccine.
but
But you
if you
can
got
vaccinate
COVID,
as well, after 2 to 3 months because of the natural immunity.
but if you already got COVID, you have the immunity. You said you need to get vaccinated after 3 months. Does that mean when you get your vaccine, you have to be revaccinated every so often?
we
No.
don't know.
No,
No.
you can get the vaccine maybe as early as long as you're out of the quarantine. Okay, which is about 10 to 14 days. If you want to get vaccinated in 3 weeks, it's not a contraindication. You can, but studies have shown that your natural immunity can last up to 3 months, so you can delay it. But you can get the vaccine anytime as long as you're not quarantined anymore.
Okay, so now that we vaccinated a lot of people, not a ton, but a few, especially those in the healthcare professionals. What's the feeling now that you're working in a hospital? I mean, I bet in the beginning last year when the pandemic hit, everybody was scared. So now that you have this vaccine, did anything change? They asked Bernadette.
In the hospital, well, we still use the same protection: N95, double mask. We have shields. We still wear the gown when we do patient care. But because we're more aware of this, they actually get early treatment. So ngayon, there's not as much like really sick patients, at least where I am in New Jersey. Our census right now, we have about 30 patients in the building. At one point, we had about 200 last year. So nothing has changed. We're still very protective. We protect ourselves. We treat them better now because we all these medications have come out. And there's still no real treatment to it. But I think we're better.
That's good news. I mean, that's a good feeling. That maybe we're learning or we learned or we have new ways to treat this virus, and also we're trying to be social distance and be what do you call it, be aware of what we can and we cannot do. As a Filipino Americans, what can we tell our communities so that we can continue to stay safe and healthy while waiting for the vaccines?
I'd say continue social distancing. Do not gather. Gathering into a handful. I know it's hard. It's hard to avoid it, but when you are with each other, mask up, stay far from each other, wash your hands. Especially when you have somebody that's old and that are sick, try to keep them away from gathering.
Mhm. For me as a physician, when you're exposed, when you know that you're highly exposed, high exposure means that you got in contact with someone within 6 feet without the mask for more than 15 minutes, quarantine already. Don't come out and infect other people. So, um, so if you know that you're exposed, do that. And if you're feeling sick, stay home or see a doctor. Get yourself swabbed, get tested, and be responsible in telling people who are exposed to you because we want to contain this virus. So that's the responsibility of the public.
Have you actually met Filipino Americans who are skeptical about any kind of vaccine, and how do you talk to them? Either of you or
So
both?
okay, all right. So well, I respect their opinion, but the way I answer their skepticism is so I explain how these vaccines work. Okay, so it doesn't affect the DNA. It doesn't. It's like so. Let me just tell you that the mRNA vaccine, what it does is it when it's introduced in the body, so it it tells you to make more proteins that looks like the virus. Okay, and then the body will recognize it and will develop antibody, so that when the real virus comes in the body, they know how to attack it. So it's for me, it's just explaining it in the simplest term I can.
Mhm.
um,
What
and
about those?
and
What
of
about those
course,
folks?
citing myself as an example, I got vaccinated, so and I'm
Mhm.
fine, so
Yeah,
um,
I feel like that each of us who have received the vaccine are ambassadors and our spokesperson, people of the importance of getting it. And look, what we are okay as a breastfeeding mom. I am okay. My baby is okay, even though he cries a little bit here and there. He's still okay. And
mhm.
I even ended up um, entering a study so that they could test my breast milk to see the effects of the COVID vaccine. So I think it's all up to us to talk to our own friends, our viewers, our partners, to tell them about how the importance of the COVID vaccine.
I think most of the people, my family anyway, and my friends are really lining up to get the vaccines. It's just a matter of acquiring them. And then there's this question, do they have a choice? Do they pick the Pfizer, the Moderna, or should they wait for the Johnson and Johnson, the one-shot vaccine? So Bernadette and Doc Alice, feel free to chime in. Which one do you think, or does it matter what kind of vaccine you get?
For me, it doesn't matter. They both work the
Yeah,
same
what
way.
from I guess if whatever is available out there, Pfizer or Moderna, they have the same mechanism of
What
action.
about the one-shot vaccine from Johnson and Johnson? I mean, hopefully by the time I'm eligible to get a vaccine, because I'm not in healthcare, I'm not 65 and over. Um, you think that will be available soon? So be extra supply of vaccine for people like me.
That would be great. You know, all these vaccines won't be approved by FDA if it's not safe for all of us.
Yeah, that's what I said. They wouldn't be giving it to people if it's not approved.
Yeah, there was someone who commented, it's like there's all these global powers and they don't agree with anything. And this is the one thing that they agree on is I think it's safe to say that that we should all get vaccines to reach that herd immunity. So Doc Alice and Bernadette, if you can tell us like what is this term herd immunity and what happens if we don't reach it?
So, from what I understand, herd immunity is like the population immunity, either by having vaccines or by acquiring the disease. So we're all immune to it. Each disease actually has different percentage of how to get the immunity. Like for example, measles, you have to have like a 90-95% immunity for the community for you to prevent the disease. With COVID-19, because it's so new, I know Dr. Fauci recommended to 75% herd immunity. It would be great. And how do we reach that is when we get the vaccine in the first place. Secondly, if we all participate, if we all sign up and get it, so that will actually help prevent spread and keep us safe from acquiring it.
What
So
do
to
you
go
think?
back to Jen's question, do you see an end to this, or are we going to live with COVID the way we have lived with the flu all our lives?
So, Korean, we don't know the answer to that yet because everything is ongoing. Okay, we don't even know if this is this immunity lasts for a lifetime or is it like a flu shot? Where you know um, it mutates every year and we have different sets of vaccines annually. So we don't know yet. I wish it's going to be like varicella or
Something that
measles.
will go away.
Or, or that's it. It's a lifetime immunity. I hope so, but
But what do you tell the people who are just staying home? They're so scared to go outside. They don't go to restaurants. They don't go to grocery stores. They're so really scared of being sick. What do you tell them, being a healthcare professional?
just follow the guideline. Wear mask. You can go out, wear mask. Don't touch your face. Always sanitize your hands. Social distancing. Um, that's it. Just follow the guidelines.
Can
I've
you
been
go?
faced.
Can you go
I've been
in the
faced with
dining?
infection every day. I swab. you know, I have family members. I have, someone very very close to me who got infected, and we're still okay. So it's really just following strictly the guidelines. You can come out, just wear mask and protect yourself, and yep, and don't let your guard down.
Well, do you need insurance to get the vaccine?
No, you don't. It's free for all. But
Is
after
it?
the
No,
pandemic, it's a different story. When the pandemic is over, and I think they're gonna have like most likely, if you have insurance, you'll be covered. But if you don't have insurance, probably there's a fee to it. But right now, everybody's free. The government's paying for it.
Mhm. So yeah, so I'm offering that in my practice, right? So it's free for the uninsured and Medicaid. And if you have insurance, it's paid for by the insurance, but it's pay deductible. So there's no out of pocket cost to the patient. So it's really good. So yeah, and in fact, I'm doing community testing. So we have um, different offsite places where we do COVID testing, even in food pantries, churches. So we're doing that.
Okay, there's so many questions. In short, 30 seconds, what else can you tell the public so that we could continue, then hopefully flatten the curve? Go ahead, Bernadette.
I'd say, please practice safe distancing, 6 feet apart, mask away, wash your hands. Don't go out often. Don't go to gatherings. If you feel any symptoms, just isolate yourself, get yourself tested, call your doctors. Just stay safe. And
Thank you. Thank you again. That's it for our panel. Sorry it's so quick. And I think we talked about a lot of issues that are going on in people's minds. And to our viewers, to everyone, thank you for being here. Continue to stay safe, stay healthy. Remember, we are all in this together. To the cast and crew, thank you. Maraming salamat. Sa ulitin, until next time, here at Makilala TV. Does it matter where you get the vaccine, whether it's at a mega site, a health clinic, or at a pharmacy?
I would take the vaccine whenever and wherever it's available.
As long as the government authorizes that specific location, you can. In fact, I went through a rigid screening in order to sign me up as a distributor of the vaccine, and I'm still waiting for it. So, but also you have to remember that when you get Pfizer vaccine, you have to get Pfizer as the second dose. And as long as you have that card, you really don't have to get it on the same place where you get your first dose. You can go to another place to get your second dose. Just show that vaccine record card.